Hello, welcome to my YouTube channel. I'm Dr. Swati Mehta, and this educational presentation I'm delivering here on adenomyosis. In this video, we will discuss the definition, causes, symptoms, risk factors, diagnosis, management, and important homeopathic therapeutics used in adenomyosis. Adenomyosis is a gynecological condition in which the tissue that normally lines the uterus, called the endometrium, it grows into the muscular wall of the uterus known as myometrium. As these endometrial glands and stroma invades the uterine muscle that continues to respond to hormonal changes during the menstrual cycle. This causes repeated bleeding within the muscular layer, leading to inflammation, enlargement of the uterus, pain, and heavy menstrual bleeding. Adenomyosis may affect the entire uterus diffusely or may remain localized in one area. It is commonly seen in the women between 40 and 50 years of the age and is more frequent in the women who have had one or more pregnancies. The exact cause remains uncertain, but several theories have been proposed. The first one is developmental theory. According to this theory, endometrial tissue becomes trapped within the uterine muscle during fetal development before birth. Second theory is inflammatory theory. Inflammation follow uterine surgeries such as caesarean section, dilatation and curettage, or fibroid removal may weaken the boundary between the endometrium and the myometrium, allowing tissue to invasion. Third one is tissue injury and repair theory. After uterine injury, healing process may direct endometrial cells inward into the muscular wall instead of outward. Stem cell theory, that is the fourth one. Bone marrow derived stem cells may migrate into the uterus and transform into endometrial like tissues within the muscular layer. The role of hormones, that is the last theory, estrogen plays a major role in the growth and maintenance of the adenomyosis. Symptoms often improve after the menopause when estrogen level declines. This picture shows different theories of causes of adenomyosis, and because of this picture, one can remember the cause nicely. Some women with adenomyosis may have no symptoms at all, while others experience significant discomfort. First one is heavy menstrual bleeding. The enlarged uterine muscle and increased blood vessels formation contribute to prolonged and heavy periods. Severe dysmenorrhea, that is the pain intense during menstruation. The pain may be sharp, stabbing, or cramping because the trapped endometrial tissue inside the muscle bleeds during menstruation. Chronic pelvic pain, because of the inflammation, it produces continuous pelvic pain even between the menstrual periods. Because of this, deep penetration during intercourse may cause pain because the enlarged uterus becomes tender and sensitive. The uterus may be enlarged to 2 or 3 times of its normal size, causing abdominal fullness. Women frequently complain of pelvic pressure, abdominal distension, and a sensation of heaviness. Several factors increase the likelihood of developing adenomyosis. First one is the age. The condition is most commonly diagnosed in women aged 40 to 50 years. Second, multiple pregnancies. Repeated pregnancies may alter the uterine wall and increase the chance of endometrial tissue invading the muscle. Third, previous uterine surgery. Procedures such as caesarean delivery, myomectomy, and curettage can disrupt the uterine architecture and increase the risk. Fourth, long-term estrogen exposure. Women exposed to estrogen for many reproductive years may be more susceptible for adenomyosis. For the diagnosis of adenomyosis, the first step is pelvic examination. The physician may find a uniformly enlarged, tender, and boggy uterus. Ultrasound, by transvaginal ultrasound, it helps to identify the thickening of uterine muscle and other characteristic changes. It also helps rule out the fibroids. Sonohysterography, saline is introduced into the uterus to better visualize abnormalities and evaluate the uterine cavity. MRI, magnetic resonance imaging, is considered one of the most accurate methods for diagnosing the adenomyosis. It clearly shows the depth and extent of myometrial involvement. Myometrial biopsy, occasionally performing during the laparoscopy for confirmation. CA125. The blood marker may elevated, although it is not specific for adenomyosis. Endometrial biopsy, used to exclude cancer and other causes of abnormal bleeding. Treatment depends on the severity of the symptoms and the patient's desire for future fertility. Anti-inflammatory drugs. NSAIDs reduce the pain and menstrual cramp by decreasing prostaglandin production. This is an allopathic treatment, just to know you. Hormonal therapy. Birth control pills, progesterone therapies, and hormonal intrauterine device help to control the bleeding and pain. Again, this is an allopathic treatment. Uterine artery embolization. Tiny particles are injected into the blood vessel, supplying the uterus, which reduce the blood flow, causing shrinkage of the adenomyotic tissue and symptoms relief. Endometrial ablation. The uterine lining is destroyed using minimally invasive techniques. This may help women with superficial adenomyosis. Hysterectomy. Removal of the uterus is the definitive treatment for severe cases where childbearing is complete. The difference between adenomyosis and endometriosis. Although both conditions involve endometrial tissues, they differ significantly. Adenomyosis, the endometrial tissue grows within the muscular wall of the uterus, usually affect the woman between the age of 40 and 50 years. The uterus becomes enlarged and painful. Heavy menstrual bleeding is a prominent symptom of adenomyosis. Endometriosis, that means the endometrial tissue grows outside the uterus, commonly affecting the ovaries, fallopian tubes, and pelvic cavity. More commonly in the women in their 30s and 40s, infertility and pelvic adhesions are frequently complications. So adenomyosis means cells growing inside the muscle, while endometriosis means cells growing outside the muscles, though both are of the disease of endometrium. Now let us discuss the important homeopathic remedies used in adenomyosis. Remedies selection should always be based on the totality of symptoms, menstrual characteristic, pain pattern, and constitutive features of the patient. And I use many of the homeopathic medicines which I am going to discuss here for the patients of adenomyosis and got the marvelous results. Sabina is one of the most important remedies for adenomyosis with excessive uterine bleeding. There is profuse bright red bleeding, partly clotted and partly fluid, and there is the pain from sacrum to pubis and from below upwards shooting up in the vagina. These are the typical symptoms of Sabina. Leukorrhea after menses, which is corrosive and offensive. There is increased sexual desire. Pain radiating into the thighs, that is also one of the peculiar symptoms. The cause is atonicity of the uterus. Music is intolerable and it produces nervousness. So therapeutic application, if we can consider, it is useful when adenomyosis causes heavy bleeding, partly clotted and partly fluid, associated with intense pelvic pain and uterine congestion. Thlaspi bursa pastoris is used when there is a frequent and profuse menses, large clots with severe uterine colic, offensive leukorrhea which is bloody, chronic uterine hemorrhage. We can consider it is a metrorrhagia, too frequent and copious menses. Every alternate period is very profuse, that is a history, and leukorrhea before and after menses, which is bloody, dark, offensive, and stains indebility. There is uterine hemorrhage with cramps and expulsion of clots. So when the clots will come out, patient is having severe pain, and that is the peculiarity of Thlaspi bursa. There is chronic cystitis, dysuria, and spasmodic retention. Patient may have urethritis and urine runs away in little checks. So therapeutic application we can consider, it is valuable in cases with recurrent menorrhagia and metrorrhagia, persistent blood loss leading to weakness and anemia, where every alternate period is profuse. And the peculiarity of Thlaspi is the first day there is mere show, second day there is a profuse, there is a colic, and the third day patients have start heavy bleeding. Ustilago is used where there is a profuse menses after miscarriage and the discharge of the blood from the slightest provocation, or patient is having menorrhagia at the climaxis, means at the premenopausal syndrome we can use Ustilago. Bright red or dark stringy blood, enlarged hypertrophied uterus, easily bleeding cervix. Cervix bleeds easily. When you touch, when you do PV examination, patient have bleeding. Burning ovarian pain, muscular weakness or muscular debility, sensation of boiling water along the back, muscular contractions especially of the lower extremities. So it is helpful in adenomyosis associated with uterine enlargement and chronic hemorrhagic tendencies. The characteristic features of Trillium pendulum are gushing bright red bleeding or hemorrhage, severe weakness and dizziness, sensation that hips and back are falling apart and they are better by tight bandage. Relief from the tight pressure and bandaging is the peculiar symptom of Trillium pendulum where there is a backache. Excellent remedy for debilitating uterine bleeding accompanied by marked exhaustion. Calcarea carb typically suited to fat, fair, flabby, overweight women with profuse perspiration, especially of the head, and there is chilliness of the patient. Any season, patient feels chilly. The symptoms are prolonged, early and profuse menses with vertigo, toothache, and cold damp feet during menses. The least excitement causes the return. Means slightest mental or physical exertion causes heavy bleeding. Cutting in uterine pain, milky leukorrhea, anxiety and fear, fear of loss of vision, misfortune, fear of contagious disease. Patient is having dreams of dead persons. Patient is forgetful, confused, low spirited. Obstinacy, which is slight mental effort, produce hot head. Patient aversion to work or exertion. So this medicine, and one more thing is increase sexual desire. So this medicine is useful when the woman with characteristic Calcarea carb constitutional features, increase sexual desire and cold feet during menstruation. With that, patient is having pain between the shoulder blades impeding the breathing and fear of misfortune, loss of reason, and menstrual efforts causing more bleeding, then we can consider Calcarea carb. Colocynth is generally used for relieving the pain. So there is severe ovarian pain, round small cystic tumor in ovaries or broad ligaments, we can find out by USG. There is boring pain in the ovary and must draw up. Relief by bending double. So patient wants always abdomen supported by the pressure. Pain extending into the thighs. There is a contraction of muscles, and this pain in the muscle and tendons feels too short, and there is numbness of the pain. So it is indicated when cramping pain is dominant symptom and pressure gives marked relief. So we can consider this is the painkiller of homeopathy in adenomyosis. Magnesia Phos is another medicine of homeopathy for the pain relief. There is severe menstrual colic and neuralgic ovarian pain. There is a membranous dysmenorrhea. So when the clots come out, patient is having severe pain because menses is too early, dark and stringy. There is vaginismus, means spasms of vagina is also present. Patient is better by warmth and pressure. In Colocynthis, patient is better by pressure, abdominal pressure. Here, warmth is more important. So relieved by rubbing, warmth and pressure. With this, patient is accompanied with belching of the gas, which gives no relief. So one of the cause of pain in abdomen is gas also. Bloated, full sensation in abdomen, must lose the clothing and walk about and constantly pass the flatus. Patient is having inability to thinking clearly and sleepless on account of indigestion. So one of the best remedies for spasmodic or membranous dysmenorrhea associated with adenomyosis. Viburnum opulus is used for crampy dysmenorrhea. It may be a membranous or it may be a spasmodic dysmenorrhea. There is history of too late and scanty menses which lasting a few hours only, and the offensive order is well marked with crampy pain and cramp extend down to the thighs. With this there is a bearing down sensation and sacral backache, aching in the sacrum and pubes with pain in anterior muscles of the thighs. Another medicine we can consider is xanthosylum, but this medicine is xanthosylum is for the neuralgic pain. Here there is a spasmodic pain. Excoriating leukorrhea, and because of excoriating leukorrhea there is smarting and itching of the genitals. Patient is so weak that faints on attempting to sit up, and pain from back to loins and warm aggravated in early morning. So particularly useful in women whose primary complaint is severe cramping before and during menstruation, very scanty menses only lasting for few hours, and there is a spasmodic or membranous dysmenorrhea, fainting attempt, then we can find out Viburnum opulus to be used there. Comparative study or quick revision. Sabina is indicated in cases of profuse bright uterine bleeding, which is partly clotted and partly fluid, especially when pain extends from the sacrum to pubis and down to the thighs. Thlaspi bursa is useful for excessive and frequent menstrual bleeding, accompanied by severe uterine colic, large clots, and persistent weakness due to blood loss, and every alternate period is profuse. Ustilago is valuable remedy for enlarged congested uterus with dark stringy hemorrhage and bleeding triggered by slightest exertion, either at the menopause or it is after the miscarriage. Trillium pendulum is prescribed when there is a gushing bright red bleeding associated with extreme weakness, dizziness and sensation that the hips and lower backs are falling apart. Calcarea carb suits to the women who are fat, fair, flabby, chilly, prone to have profuse prolonged menstruation. During menstruation, patient is having cold feet and aggravated by slightest physical or mental exertion. It is especially useful when adenomyosis is associated with hormonal imbalance and uterine displacement. Colocynthis is indicated for severe cramping pelvic pain that forces the patient to bend double, and it is relieved by firm pressure, while magnesium phos is one of the remedy for spasmodic menstrual pain, especially when cramps are relieved by warmth, pressure and gentle rubbing. Viburnum opulus is beneficial for the cramp-like dysmenorrhea, bearing down pain, and menstrual discomfort radiating to the thighs and low back. And Viburnum opulus, the menses remains only for a few hours, and patient may have fainting attacks. Adenomyosis is a common yet often undiagnosed condition that significantly affects a woman's quality of life. It commonly presents with heavy menstrual bleeding, severe menstrual pain, chronic pelvic discomfort, and uterine enlargement. Early diagnosis, though through ultrasound or MRI, along with appropriate management, can greatly improve the symptoms. Homeopathic therapeutics may be selected on the basis of individual symptom, the picture of the disease condition, constitutional characteristics, type of pain, and type of bleeding. Thank you for watching my video. If you found this presentation helpful, please like, share and subscribe for more educational content on gynecology and homeopathic therapeutics.